Hello, my name is Frank Pagliaro, and I'm an attorney and a businessman, and I live in Burlingame, where I raised my family, along with my wife Bonnie, who was a kindergarten teacher for 40 years in the San Bruno Park School District. The Peninsula Healthcare District that I'm running for the Board of Directors of has a broad spectrum of projects that it has supported for over a decade. The district has around a $5 million budget and has spent it on a number of projects that are spread from San Bruno to Foster City. I believe that I have the background that will help the Board of Directors in many of the areas that they concentrate on. For instance, mental health. The district has funded a considerable number of projects in our high school and our schools to help our young people, as well as for senior citizens. I served for several years on the Board of Directors of the San Mateo Mental Health Association. The district also spends a lot of money helping our young people, our young adults, and our children. $10.5 million was spent in the last 3 years with programs in the schools, with $4 million of it alone going to K through 8. Now, I've had a lot of involvement with youth programs, including 15 years of coaching soccer and baseball with both boys and girls. The school district in Burlingame appointed me to a facilities task force. The San Mateo Union School District appointed me to 2 commissions, both of which I was chairman of. Each one went for a year and unfortunately had to deal with the contentious issue of whether or not to close one of the high schools, and if so, which one. Just last year, the Community College District appointed me as a member of the Bond Oversight Committee, and there are hundreds of millions of dollars of bonds that are involved in this. The Board of Supervisors here in San Mateo County appointed me to the Delinquency Prevention Commission, and then the Superior Court judges appointed me to the Juvenile Justice Commission. So I believe that I have spent a good amount of time and gained knowledge as to what the issues are for the young people in our communities. Now, senior citizens are an important aspect of what the group that the district works with. Right now, we know that by the year 2030, the percentage of senior citizens in our community within the district will increase by 70%, and that's only 14 years away. So the district has decided to build some facilities to assist our senior citizens. Right now, just this month, they started construction of a 124-unit facility in Burlingame that is for assisted living and mental health care for our senior citizens. That project will cost $35 million. But also on the planning boards for the district is an even larger facility very nearby, 330 units for senior citizens, as well as professional offices as part of the small campus and dining room, so that seniors will be well taken care of from a mental health and a societal standpoint. Finally, and I should note that I used to be a general contractor, and therefore, if elected, I could serve as a liaison between the district board and the general contractors and design professionals for these expensive projects. Finally, as you can well imagine, the board and the district have had to deal with governmental entities in order to put through some of these programs and also to construct some of these buildings. Well, I've had experience in local government. I was elected to 3 terms to the City Council in Burlingame and served 2 of those terms as mayor. Additionally, the 20 cities within our county elected me to be their representative to the Association of Bay Area Governments, which controls millions of dollars in grants. So these are some of the reasons that I believe that my background will be of assistance to the Board of Directors, and I would greatly appreciate it if you would vote for me in November. Thank you very much.
Hi, my name is Dr. Rick Navarro. I'm running for the Peninsula Healthcare District Board. If I'm lucky enough to get reelected, this will be my 4th term. So I have some experience being on the board. I've been a practicing physician in California for many years, went to medical school right here in Palo Alto at Stanford, and I've been on the board through the beginning of the lease with the new Peninsula Hospital, all the way through watching the old hospital go down, and I'd like to see us continue to evolve in our mission at the Peninsula Healthcare District. We've continued to support people from children all the way to the elderly. One of the big things that we've done over the years is supported the Children's Health Initiative, and as a result, the healthcare district now, 18 and under, we have almost very close to 0% uninsured within the district boundaries. Our current project right now is the Truesdale, which is an assisted living facility. We did a lot of research to look at the problems that we're going to be facing in the years ahead. One of the things we have coming up are a lot of baby boomers retiring, and already people are being faced with sending their loved ones far away to Modesto or Fresno because there simply are not enough places here, affordable places in our area. So the Peninsula Healthcare District is trying to help with that. We're going to hopefully have some units that will be very affordable, and other units I think will be very competitive, so that we will have something there. In addition to that, every year we spend something like $2 million on grants, everything from the mental health issues to transportation for the elderly. I think that all of these projects that we're working on are vitally important, and I think it's important that the healthcare district continue to exist and continue to provide where it can for the citizens within our district. One of the things that we did that I think shows that the nimbleness of the Peninsula Healthcare District was when the San Bruno gas pipeline burst. We were able to support the American Red Cross to help set up a center in San Bruno, and I think we were very agile and very quick to be able to support that. So I think I want to see the healthcare district continue to do those sorts of things, and I hope I can get your vote. Thank you.
Hi, my name is Steve Duncan, and I'm running for the Peninsula Healthcare District Board. I was born in San Francisco, raised in Pacifica. I attended Skyline Junior College and transferred to San Francisco State University. I graduated with a BA in English Literature from San Francisco State. While working full-time, I completed the Reserve Police Officer Training Program at College of San Mateo. My entire work life has been about managing and serving the public in retail stores. I ran for Burlingame City Council in 2012. One of my happiest moments while campaigning was helping a resident get a sidewalk hazard fixed in front of their house. The resident thanked me. I'm a Burlingame Lions Club member and past board member. I'm a member of St. Catherine of Siena Men's Club and St. Vincent de Paul Society, helping with rent cases and food assistance. I want to provide public service to all residents of the Peninsula Healthcare District. As a cancer survivor, my surgery was August 2015, I have a renewed spirit and drive to live each day to the fullest. It is this spirit and drive I will use, if elected, to the healthcare district. I will be an advocate and work for children, minorities, and our seniors, our healthcare district's 3 prized groups. I will work with the other board members to help the disenfranchised, providing health resources for our children, and advocating for our senior healthcare services and senior assisted living housing which is available on the vacant district hospital property. I'm not a doctor. I'm not a lawyer. I'm a hardworking individual, having worked over 35 years in retail, grocery stores, and drugstores. I have real life experience and empathy for others. It is my passion and desire to serve others, and when I saw an opportunity to serve on the Peninsula Healthcare District Board, I jumped at the opportunity. The very next day, after deciding to run, I met with the CEO, Cheryl Fama, to discuss the district. I have not accepted donations, any donations, and I paid for my own campaign statement on the ballot, which was over $1,400 with my own money. I am running for the Peninsula Healthcare District because I want to provide transparency and accountability to all residents. I will listen and serve and be a voice for all the residents of the district. I would be honored to serve you and would greatly appreciate your vote on November 8th. You can vote for 2 candidates. Thank you very much.